Welcome to Tucked and Unfiltered,
the podcast where we talk all things plastic surgery
confidence,
and everything in between. Today we're diving into one of the most important first steps in your plastic surgery journey.
Your consultation.
And we have one of our leading surgeons here at South Florida Center, Dr. Cucin. Thank you so much for joining us. Welcome. So tell us a little bit about yourself. Tell us a little bit about your background story. How do you become a surgeon? What do you specialize in?
Sure.
Yeah, tell us.
Well, I became a plastic surgeon because I was originally supposed to be an engineer.
Wow.
I had a full boat scholarship to MIT.
Oh, wow.
But I took a teeny bopper tour of Europe, and one of the children on the vacation was the only one who could beat me in chess.
Okay.
And he had a facial deformity called microsomia.
Okay.
That means the growth center and the side was not developed, so he had a small ear, born without an eye, a huge jaw.
Wow.
Weird personality, but he was the only kid who could beat me with chess, so we became friends. And I saw the changes of his personality as he got the surgery, and I knew I wanted to be a face man. So I came back from that vacation, basically went and...
Now we're here.
History. Yeah, the rest is history. Became a plastic surgeon.
That's amazing.
So that's why I initially went into it, and I took the full route. I'm board certified general surgeon as well. Went the general surgery route, then into plastic surgery. For me personally, since it was the Vietnam era, I went in as a general surgeon in the military. Then I came out and did my plastic surgery residency after that. And then went out to practice, and basically it's been over 40 years now that I've been doing this, and I love it. And frankly, shouldn't tell the patients this, but I probably would do it even if I didn't get paid for it because I enjoy it so much.
Oh my God, I love that. I feel that's so important whenever you're in the plastic surgery world and you're trying to look for that perfect surgeon, having that connection with somebody who's really passionate about what they're doing.
Mm-hmm.
So
And
It's
so
a gift
experienced.
it's a gift from God to be able to do what we do.
100%. We agree with that. So, well, perfect. Thank you so much for that introduction. We're really excited to have you. And
let's dive into what happens during a consultation.
Consultation is a two-way street.
Right.
I mean, the patient is introducing, should be also interviewing the doctor to decide if it's the right doctor. And I always welcome it. Patients go to more than one doctor. That way they get different viewpoints and they really appreciate what they're getting. And it's also the opportunity for the doctor to interview the patient and see if it's the patient he can satisfy and wishes to operate on. Because once you do operate on somebody, you own it. You own that patient.
Right.
And if you pick somebody who has unrealistic expectations, somebody who's not going to be cooperative, somebody who's going to be argumentative to staff, somebody who's not going to get the splint taken off, in spite of saying they will, it can compromise the result. And for me, that's very frustrating because I'm a control freak.
Of course.
But from the patient's point of view, which we should probably start with, patients should interview the doctor, find out if the doctor makes short shrift of the patient in the first interview, before they've booked a procedure or paid for a procedure, they can be damn sure they're going to be made much short shrift of in the postoperative period.
Right.
So if you don't get the attention you want and your questions aren't answered, and you feel that you've been given not enough time, that's the wrong surgeon. Walk away.
100%.
That's number one. Number two, you want to know how many procedures, not particularly a number, because most surgeons can't give you an exact number. I've done 4,000 noses. They can give you a ballpark.
Right.
And you don't want to be anybody's first 100 of anything. And you want to make sure that somebody still has kind of the ardor and the enthusiasm to do it and they're not burnt out.
100%.
I mean, my practice in New York was so ridiculously successful, I actually took a break from it for a while, opened a medical device company. And then I found out it was liposuction devices. Then I found out I just missed it so much.
Right.
And I went back to it with, as much enthusiasm as the first time.
Refreshed.
And yes, refreshed. So the patient should make sure the doctor has enough experience, the doctor spends time with them, and listens to them. Because I always like to start out with basically asking a patient what they want to attain.
Right.
if we're talking, say, noses, it's like, well, what bothers you? You got the hump. You want it finer. You want a Barbie nose. You want an ethnic nose to look more Caucasian, just more narrow.
Right.
If you have if you have
expectations.
a breast, I mean, can you deal with scars, or you basically want a scarless lift, which is just essentially an implant? Get an idea what the patient wants, and the doctor will say, well, I can do that or I can't do that.
Right, right.
Hearing the goals, seeing if they're realistic.
100%.
How a patient heals, if they're a keloid tumor or hypertrophic scars.
Those
All of
things are
those
really
are
important.
questions which are very important, and you have to basically set expectations. I like to, promise low and deliver high. Yeah, set expectations realistic that you've got a pretty damn good chance of meeting them, and that way you've got a very good chance of being a happy patient, having a patient be happy, and the patient knowing what's reasonable and what's not reasonable. What may be reasonable for me might not be reasonable for another surgeon.
Right.
So that's why I always welcome patients to see more than one doctor and get more than one opinion, because then they've got a chance to make an informed decision. For me, that makes my job easier.
Of course. No, of course. Because most people do not realize a consultation is like a two-way conversation. And we always see it pretty often. They just think it's a diagnosis. My doctor will tell me what I need to hear. And then they just go off with that. But
and that's a good point you make. When patients come in very frequently, well, the studies have shown that 70% of what's said in the consultation just goes out the window. Patients don't remember it. 70%. The other thing is patients have a habit of just going to a diagnosis. And when they come in, they go to a doctor and they're basically talking to a doctor. They're talking diagnosis. I have a deviated septum. The doctor doesn't want the patient's diagnosis. He doesn't want another doctor's diagnosis, unless you're talking about radiology and an MRI or something like that. What you want to hear are the symptoms, so the doctor can make his own diagnosis. I can't breathe. This side is obstructed. Give me the symptoms. I can make the decision. Yeah, your septum's over to one side.
yeah, it's so important to listen to the professional because you can have the questions, bring up the issues, and we're here to resolve them.
Yeah.
Where we have experts, plastic surgeons here in South Florida Center, and I believe that way they can provide the answers that you're looking for. And the patient is.
And we all don't like to do this, all the different procedures. Some of us like to specialize. I like to specialize in nose and gynecomastia.
Right.
We all have our little preferences.
Yeah, of course, like everything. Perfect. Now that we have all that background information, we're gonna skip to the smart questions to ask a surgeon. So I hope you're ready for some Q&As directly.
Sure.
So Caroline, do you want to start off with the first question?
Yeah, definitely. What are some questions patients should be asking, but they often don't?
Well, about every procedure is a little bit different, but
Right.
you start with the basic ones that we just mentioned. Is this a procedure the doctor does a lot of? There's nothing wrong with asking, well, are your patients usually happy? Nothing wrong with asking questions like that. Nothing wrong with asking for befores and afters.
Definitely.
Now we have everything's Instagramming.
Right.
I had hard copy books, for every different procedure that I just had in the waiting room, and the patients could go through the books. And
Wow.
I always tell them, find somebody with a skin type and a facial feature similar to you, and see the kind of result that was attained on them. And that's the way you get a realistic result. You don't get a realistic expectation if you basically pick out Cindy Crawford, or you have Megan Fox, or Charlize Theron, and you have dark, thick, oily skin. You got to pick somebody who's kind of similar to you to be able to get a realistic expectation.
Great point. So what do you think about reference photos? Do you like if your patients bring them in?
I like it when they bring them in, and I'm always very candid with them. I just say, it's like, this is a beautiful picture, but this is very far removed from you.
We keep it honest here. I like it. I like it. No, that's really, really, really important. And people tend to get shy on those topics. And what about like, what's your advice on asking about recovery, risk, and results? Because people tend to get like a little bit scared. And sometimes they're like, what can I ask? Or there's sometimes over exaggerate. So what's like your tips when it comes to like the
No,
recovery
basically
process?
be honest, and there's nothing to be. You have to ask you shouldn't be afraid to ask any question. When can you have sex after surgery?
Right?
I mean, when can you work out with weights? When
Right.
can you go out in the sun? When can you ride a horse? Whatever is relevant to the patient,
Correct.
the patient should ask.
Yeah.
Based off of their
I
lifestyle.
mean, I had an ACL repair. One of the important things that was in my left knee. Now, obviously, I wanted to not just know whether I could ski again, which I can, but uh, I'm only 5'7". So the bottom line is that I didn't want to have to use a riding block when I mount the horse.
Right.
So it was important to me I retain flexion. So whatever it is for a particular procedure,
Ask
the
it.
patient should, if you're going to wear glasses, how soon can you wear the glasses if you wear heavy ones? Those are the kind of questions that are relevant that somebody should ask.
Yeah, no, 100%. So just keep in mind, if you're a patient here, it's like, don't forget to ask about before and after results. Revision policies are 100% okay. Don't be afraid of those either. Like, remember that this journey is about your safety, and what matters the most is also the results. We want to keep you safe, and we want to keep the results amazingly beautiful for you. So, I mean, thank you for that. Definitely.
I want to take up on the revision.
Yeah.
Different procedures have different frequencies of revision.
Okay.
With a nose, my is less than 1 or 2 in 100.
Amazing.
But me personally. But if you start talking about certain procedures like breast and breast lifts, it's fairly common, that 5% of the scars are going to have little issues.
Right.
So for every procedure, it's a little bit different. And then you also have, when somebody asks about convalescence, it's very relevant what somebody does. If somebody's an accountant and they're basically working at numbers and they're working on the telephone, well, you go back to work. You can work with your cast on. I've had nurses work with the cast on after I've done their nose.
Right.
If somebody's a laborer, and they've got a lift, let's say they're a baggage attendant, well, that's 3 weeks before you're going to be lifting anything heavy because that's the workout.
Right.
So questions are relevant to the particular patient, which is why the doctor's got to answer those questions if the patient doesn't think to ask them.
100%, 100%. Well, thank you for we already went over smart questions because we wanted to provide you guys.
You can ask me some dumb ones too.
No, I love that, but we definitely gave you guys a cheat sheet for you guys to prepare for your consultation. Now let's go over the red flags. So
let's dive into some red flags and what patients should avoid during a consultation.
Okay. Well, if a doctor doesn't have some befores and afters to show you,
definitely,
and if he's fresh out of med school and basically has very little experience.
Remember the phrase Dr. Cucin said, you don't want to be the first 100 of anything.
Yeah. And there's another point I used to make. You want somebody who is board certified. But let's say you have somebody who's done 4,000 blepharoplasties and doesn't have the boards. That person probably can do a very good flap, but will not be able to handle a consultation without kind of the depths that you get with the certification. So everything's relevant. So I mean, but if you got something simple and you want to save a few bucks, maybe the patient can get away with that. But the bottom line, when it comes to the complication, then you really need the board certified person who has been fully trained and can deal with the complication.
Right.
And they do happen sometimes. They happen very infrequently if the patients are screened well. But if the screening is casual, things can get
Right. It's important to, do your research, take your time. I feel we're in this era where a lot of information are in our hands. So use it for your advantage. Do not overconsume information, but definitely do your research. Take notes, a lot of notes, because people sometimes tend to forget the questions they want to ask.
And while you're on doing research, there is a lot of garbage on the internet.
100%.
So you have to be a little bit careful. The patients have to be careful and maybe run it by some authoritative figure. This is what I read. Is this really true, or is just a rosy picture? Because there are many rosy pictures painted on the internet. There's some bleak ones too, but there's which are infrequent. But some of those bleaks are legitimate. But I'd say more often there are more rosy pictures.
Yeah, we have so many patients that come in and say, I saw this on social media, and most times it's not even factually correct.
No.
So that's a great point. Always make sure to ask your surgeon, ask the question, no matter how small or big it is.
Yeah, 100%.
You know, it's big for you, even if it's relatively small in the context of the work.
Yeah,
of course. You're going to stay with this for the rest of your life. Like, this is a life changing decision, 100%. Like, it's going to boost your confidence. You're going to feel better about yourself. But obviously, it all will depend on who you choose as your surgeon as well. So definitely never feel pressured to book on the spot. Like, the goal, like, we have been making an emphasis for a reason. It's like to make an informed decision, not a rushed one. Not a rush. Not because it's summer and you want to look good in a bikini. Like, you want to book for next month. No. Let's try to slow it down, do your research, talk to your surgeon. And that's why we offer the free virtual consultation, because we want to make sure you are sure before booking with us. For sure. For sure.
One point I like to emphasize to the patients, it kind of came from hand surgery, is there are 3 parts to a procedure. I mean, the doctor fixes whatever the issue is. God heals it. And then the patient has to use it, which usually means the patient has to do something. Like wear a pressure garment, for a gynecomastia. Wear a splint for 7 days. Massage it afterwards, to take down swelling. Maybe come in for a shot of Kenalog to save some time. On a breast, obviously get the sutures removed, wear a support bra. There's always a part of participation of the patient which can make or break a procedure. And the God part, okay, there are infections sometimes.
You need to cooperate for sure. Like, it's like we mentioned earlier, it's a 2-way conversation. This is a 2-way journey as well. You need to take care of yourself, change your lifestyle. If you're getting something like a tummy tuck or like a lipo, make sure you're active so you can like actually keep the results that you want to see in the long term. That's also people sometimes like they tend to forget a little bit about it. So that's a great point, Dr. Cucin, for sure.
Always be transparent with your surgeon.
Sure. I mean, for example, if somebody's losing a bunch of weight and they come and get a facelift. If you lose weight after a facelift, you're just blown. You just thrown your money away.
Right.
So, I mean, there's certain things, talk to your doctor about, and just have some common sense.
Yeah. Never be afraid of saying if you smoke anything, the type of lifestyle that you have, if you're active, if you're not active.
Smoking's bad for the skin. So, I mean, if you're going to do nipple transplants, on a breast lift, or you're going to have a facelift, smoking is horrendous for the skin.
100%.
For the recovery, there could be necrosis.
100%.
Forget just the coughing, pulmonary stuff. It basically takes away the blood supply from the skin.
There you go. We have to be really transparent with the doctor and with ourselves.
Yes.
100%. Before you're spending those thousands of dollars, make sure you're honest with yourself as well. Awesome. I mean, Dr. Cucin, this has been amazing. And I just want to close this segment off with let's just talk about your top tips. Like, what's your number 1 piece of advice for anyone booking a consultation for the first time? Like, your number 1, something that they cannot miss.
Set enough time aside that you've got an uninterrupted 15 minutes, and pick a setting that I'm not doing a consultation with somebody in a bathroom stall at school.
Driving their car.
Yeah, well, I won't let somebody drive. I mean, I just will refuse us to park the car. Right. I only fix, I fix faces and noses. I don't want to fix the rest of the body. My general surgery days are behind.
That's a great point. Make sure to be ready for your consultation.
Yeah, I mean, if you're going to do it at work, then make sure you've got a break that you can get away from work. Not that there's going to be a phone in the background distracting you. 'Cause, as I said, 70% of the facts of what you say is gone anyway. But so at least give yourself a chance to remember it.
Definitely.
Maybe take a few notes.
100%. I feel this also applies for like any nervous patients. Like, 'cause sometimes people are a little nervous to undergo surgery. Like, anything especially for them, or?
Well, one thing I always say is that if a patient's not nervous, I get nervous. Because normal people get nervous when they undergo the knife. I mean, that's a normal response. If a patient doesn't get nervous, they either have von Munchausen syndrome, where they really just like to get, medical attention. Or they've had a little bit too much surgery that maybe they're a little bit dysmorphic. You shouldn't be operating on them.
I love that. But that's gonna be a topic that we're gonna be discussing down the lane, because this dysmorphia is really, really important. Awesome. I mean,
the magazines aren't as bad these days. I mean, during the 80s, when everybody was Twiggy, or everybody was the supermodel, that was unattainable. So the bottom line is, everybody was dysmorphic, everybody was bulimic.
Wow.
Now that you're seeing the plus models, and you're seeing kind of a more normal,
realistic standard.
More realistic standard. It's, thank God, it's just. People are still dysmorphic, but not to the same degree they were before.
100%. Well, thank you so much for all this insight. The information
thanks for having me. My
has
pleasure.
been amazing. So remember, this is your body,
your journey,
and don't forget to ask the questions, take the notes, and trust your gut. Remember that we're gonna keep posting these episodes, and for the next one, I'm gonna tease you just a little bit, and there are things that people don't often talk about. So,
comment below if you think you know.
I am so excited for this one. So, don't forget to follow us on social media,
subscribe,
and book your consult at South Florida Center, because we have amazing surgeons like Dr. Cucin, and we cannot wait for you to meet the other ones. The link is going to be down below, and we'll see you next time.
Check it out.
Bye.